Welcome back to Midday Kentucky, everyone, with Dr. Bacha. He's in the studio from Anti-Aging Institute, as well as our very own Eric Burke. And we're talking about PRP, and long gone are the days that you no longer need to worry about if you're losing a bit of hair. You don't need to wear a toupee anymore.
No.
Are we
all
right?
Natural.
All
right.
a la naturel. Okay, talk to us a little bit about what PRP is and what those three letters stand for.
It stands for plasma-rich platelet.
And what does that mean?
Well, we separate the platelet from the blood. With that also we use a serum, and all have the platelet activator growth factors to help with a variety of condition, not just with hair rejuvenation, but we can also use it for treatment of facial rejuvenation, neck area, hand area. So it has a lot of application of PRP. It's the platelet have a similar to a mini stem cell properties.
Oh, okay. So Eric, you're not bald as what we would class as bald, is that correct?
That's correct.
His hair's just thinning.
Yes,
he's a
that's
perfect,
the polite way of putting it.
He's a perfect candidate, I'll put it this way.
Okay, now, how does that work for someone like Eric? He comes in and talk us through the process.
Well, first we do a consultation. Consultation is for free.
Yeah.
And we'll decide whether he is a good candidate or whether he's gone so far where he'll need a hair transplant.
Okay.
So, you showed me the picture of Eric. I told you he's a prime candidate, and I told Eric time is hair.
He doesn't get to hear that very often.
No,
he's a prime candidate.
Perfect candidate. Yes.
Perfect candidate. So time is hair. You want to get on this process early, because if you lose the hair from an area completely, a PRP will not be helpful, and the only option you'll have will be a hair transplant.
Okay, so we started off by drawing blood.
That's correct.
Then what is the process after
We'll
that?
spin the blood, separate the platelet, and then during that time, Eric's scalp is getting numbed up really good.
Yeah.
And then we have a device called microneedling, and we go over the skin.
That's
and
what that was.
That's what it is. And this one is a 12 rotating, very, very tiny microneedles that putting about 2 to 2.5 millimeter needle poke into Eric's scalp. And he's not feeling it. I mean, look at him, he's smiling.
No.
And
what's this process?
And then
just
this is the platelet-rich plasma. After I did the microneedling, I injected those into Eric's scalp and help bring in a lot of those repair cells around the hair follicle, so they can rejuvenate and nourish these falling hair follicle, so we can make them stronger, make the hair thicker, and grow more like a natural process.
Okay, Eric, what we're seeing here is needles.
Yes.
Are we feeling any pain?
No, and during the consultation, he said it's going to be painless, and I kind of said, that's too good to be true.
No, Troy sent me over. There's pain.
Yeah, but they took my blood when they were spinning it. He put the gel on first, and then he did the numbing shots. And even in the back of my head and on my eyebrow, I barely felt a thing. He's like, you're going to feel a pinch, and I didn't even feel the needle until the hands of a surgeon, this man. And then it's more of a weird sensation, because you could feel, he's obviously working on my scalp there, but you don't really feel it. You just kind of feel the pressure. Every now and again, you'll get a little pinch, but I say this in all honesty, a very pleasant experience all around.
How about afterward? I mean,
Afterward, now, I had the weekend planned. I did it on a Friday, because you're going to be a little red. You're a little kind of greasy from the some of the agents that I had in my hair. I planned out a whole weekend. I had books, I had movies, all lined up, thinking it's going to be tough. I took one round of Advil.
Okay.
After that, fine.
Basically pain-free.
More or less.
You have more pain from a filling.
Yes.
Okay.
Absolutely.
Now, is this for men and women?
That's correct. If they are the right type of hair loss, this is for men and women.
So this is thinning hair, not this does not make your hair grow back from a bald spot.
Right. If you're completely bald, that's not going to work for you. But
Right.
if you have thinning hair, get on it quickly, because we can rejuvenate those hair follicles. Now, if you're losing hair because of chemotherapy or some autoimmune process, this is not going to work for you.
Okay.
But if you're thinning hair because of hormonal imbalance, because of lack of nutrition, because of genetic component, this will be the perfect treatment for you.
Now, we've had the process, we've done all the needling, we've got video of you wiping. Is that excess platelets off the scalp, or?
No, initially the only thing we do is as I say, we rub the anesthetic on Eric's scalp, and then I'm just cleaning him.
Okay. Oh, so we just give him a tidy up.
Yeah.
That's what the way it is.
Yeah,
Okay.
so he doesn't walk around and looking like
Okay,
something.
I want to say to you, the process takes about an hour and a half.
An hour.
And then how often does he need to come back and have, does he need a second treatment?
I recommend 3 treatments. You will see most of the effect the first 2. The third one is kind of a little bit extra, and then you plateau after that. Recommend them about 2 to 3 months apart. and after that, evaluate on a yearly or every 2 years process and see if you need,
okay.
and see if you
Perfect.
need
It just takes a little bit of blood.
And
Go
yeah,
on.
I mean, I'm on my shampoo now. I've got like a Rogaine type thing. I have
Yep.
my routine each evening to kind of, you know, further
I
the
got you.
process.
All right. Now, you said to us just before we came on air that you got a promotion
That's
because of Eric.
That's correct.
What's the deal,
So,
Mr.
so,
Dr.
so
Bacha?
mention Eric or Troy, and you will get 20% off a package of 3.
Oh, perfect.
Yes. Beautiful.
That's 20% off a package of 3 over there at Dr. Bacha at the Anti-Aging Institute. All the information is up on your screen right now. Give them a phone call. They really have a great website. All the information is up there. Dr. Bacha, we thank you.
Appreciate it.
We look forward to seeing Fabio
Oh,
live.
flowing
That's
locks.
right.
We'll be right back after this short break, everyone.